Hi, it's Dr. Robert Brueck, and we're going to continue with our series on some of the basic procedures in cosmetic surgery. And these are intended more for people who want an introduction, if you will, from some of the more common procedures. Some of the basic questions will be answered, and hopefully if you have further questions and want to come in for a consultation, you can call our office at 239-244-2329. The next procedure we're going to discuss is a composite breast aug. Now, what is a composite breast aug? A composite breast aug is an augmentation, which is an enlargement of the breast that usually involves the placement of an implant, usually silicone in most cases, but can be saline. And then we enhance the effects of that by adding somebody's own soft tissue or fatty tissue. So we'll, for example, take fat from, say, the abdomen or the flanks to the thighs, and we'll augment the soft tissue envelope or covering of the implant. Now, how do we do this? This procedure is done as an outpatient. It's done under sedation, so you're sound asleep, you don't feel anything, and the procedure will take about 2 hours, 2.5 hours, depending upon the amount of soft tissue that we have to augment. Once the procedure is done, the patient is returned to the recovery room, and they're in the recovery room for maybe an hour, hour and a half, and then they go home. And then when they go home, they basically go to bed and just take it easy. Post-operatively, I tell patients the first 4 days, lay low. Don't do any heavy lifting or straining. I always hope that patients have common sense, so I say don't have this done on a Friday and then go home and start vacuuming the floor. So it's really, really important that you lay low. And a lot of times what I tell patients to do is take a little Ziploc bag with some crushed ice, put it between your breasts, and then you can go ahead and use that to minimize swelling, and it's also numbing. So between that and the pain pills, usually most patients do quite well. Now, after 4 or 5 days, you can let comfort be your guide. So if you're up and about and you're combing your hair, for example, and it's not sore, comb your hair. If it's sore, shorten your stroke or put your hair in a ponytail. Real physical activity, golf, tennis, aerobics, 4 weeks. And after 4 weeks, you can pretty much do anything you want. Now, are there any special preparations people need to make? Again, I always recommend that people stop taking any aspirin-containing compounds, nutraceuticals, things that are non-essential, things like fish oils, ginkgo biloba, things of that sort. Usually the night before, we have patients cleanse their skin with an antibacterial soap. And then they can go ahead and use this to minimize the bacterial count on their skin. The incision usually is an inframammary incision underneath the breast. And risks associated with this are with a common breast augmentation. You can have bruising, swelling, infection, bleeding, scarring. Generally speaking, depending upon the age at which you're getting it done, the implants aren't going to last forever. But I always tell people implants sometimes can last 15, 20, 30 years depending upon how you respond, what you need. And so they're very, very durable. So it's a great operation, and particularly for people that have lost a lot of soft tissue as a result of aging. So a composite breast aug may be a nice answer for a difficult problem. The next procedure we're going to talk about is a breast lift and a breast reduction. Now, what actually is a breast lift and a breast reduction? They're very, very similar in execution. The difference is that in a breast lift, we're just removing skin. We are not taking away breast tissue. In a breast reduction, we are taking away skin and breast tissue. In both cases, we're reshaping the breast, taking a breast that is ptotic or sagging and putting it into a more normal position. And I always tell people, I tell my patients, ask yourself a question: why does a breast sag? Well, it sags basically because the skin envelope is greater than the volume of breast tissue that you have. So the net result is it's sort of like a sock hanging down off your chest with an orange or an apple in it. And the breast is what we say ptotic. So in that case, you need to have a breast lift. And in some cases, women have large pendulous breasts, and it wears on their neck, back, and shoulders. They have pain, uncomfortable feelings, and sharp pains down their arms. So they may need a breast reduction. So again, we're reshaping the breast, but at the same time, we're also going ahead and reducing the size of the breast. Now, both procedures are done as an outpatient. They take anywhere from 2 to 3 hours, depending upon whether we're doing just a lift or if we're just doing a lift plus a reduction in the size of the breast. Preparations are pretty much the same. We have patients stop all anti-inflammatory medications, stop all nutraceuticals, over-the-counter medicines, ginkgo biloba, fish oils, things of that sort. Usually they'll use antibacterial soap a couple times a night before in preparation for the surgery. The surgery, once again, is done as an outpatient. It's done under IV sedation, and again, it takes anywhere between 2 and 3 hours. The patient then returns to the recovery room. I have all my patients bring a support bra with them, a sports bra, something that snaps in front, and that's generally what they'll go home in. So whether I'm doing a breast aug, a composite aug, a breast lift, a breast reduction, I usually have patients bring a sports bra with them, and that's what they'll go home in. And what's interesting now with a breast lift, sometimes people say, well, I want to do a breast lift, but I'd like to have a little more fullness. So at the same time, we sometimes will do a breast lift with a slight augmentation. That augmentation might be a small implant, or at the same time, it could be some autologous fat or fat grafting. Now, the risks of bruising, swelling, infection, bleeding, scarring, loss of nipple sensation, loss of nipple asymmetry. But again, they're very similar procedures. The difference is in one, skin only, which is the mastopexy. The breast reduction is skin plus breast tissue. Again, post-op, I tell patients the first 4 or 5 days lay low. Usually you can shower after a day or two. There are no drains put in. I rarely use drains. I can't recall the last time I've used a drain. After 4 or 5 days, let comfort be your guide. Real physical activity, golf, tennis, aerobics, ellipticals, things of that sort, usually about a month. And after a month, you're free to do whatever you want. So that's a mastopexy breast reduction. Again, sometimes with a mastopexy, we may put in a small implant, or in some cases now, we may offer an individual, if they have enough soft tissue, to augment it with some of their soft tissue. So this would be considered a composite mastopexy, so it's a lift plus the addition of fatty tissue. Both are excellent procedures to reshape the breast that has been changed as a result of aging, pregnancy, and the like. So that's a mastopexy breast reduction. The next thing I want to talk about is liposuction. Now, liposuction has been around for probably 25 or 30 years. And I'm going to make a confession to you right now. It's the one procedure that I had done, and I had it done maybe, I don't know, 25, 30 years ago. Cute little story. I remember doing a lecture at a health club, and there were maybe 50 to 75 people there. And I was giving this lecture, and one of the topics was liposuction. And as I'm talking about liposuction, in the distance, in the background, was a gentleman who was on a treadmill. And he had been on there for some time. He was sweating, and you could see the pains of agony on his face. So I quickly turned to the people I was talking to, and I said, now, you have a choice. You can go on the treadmill for the next 6 months and labor in agony like that gentleman, or you can come in and see me, have a couple hours of liposuction, and get the same benefit. So I got a few chuckles out of it, but liposuction is a great procedure. I think it's important to understand that liposuction is not a substitute for weight loss. Generally speaking, liposuction is intended to take away unwanted areas of fat that are disproportionate to the rest of the body. Now, the areas that are treated with liposuction pretty much are only limited by your imagination. You can do liposuction to the hips, to the knees, to the face, to the back, to the stomach, to the chest, to almost any area of the body is amenable to liposuction. So it's a great procedure. Now, how do we do this? Liposuction is done as an outpatient, generally with sedation, but sometimes we do it with general. And a lot depends on if we're going to be doing the flanks. For example, if we're doing the love handles on somebody, we generally will intubate them from the standpoint of patient safety. We'll suction the back, suction the flank, suction the saddlebag, suction the inner thigh. Then we'll flip a patient over and then finish suctioning, for example, the abdomen. Generally speaking, we're limited to about 3,000 to 4,000 grams, depending upon the health of the individual. And so in some cases, when we do liposuction, we may stage it. For example, we may stage it in that we might do the lower extremities, or we might do the circumferential mid-body liposuction, do the lower extremities at a later time. Many times we will do liposuction in conjunction with an abdominoplasty. Now, when we do liposuction, we generally will use what we call a tumescent technique. Now, what tumescent means is that we make small stab incisions, and then into the fat that we're going to suction, we will put a special solution in that has an anesthetic in it, as well as a vasoconstricting element which limits bruising and blood loss. We usually put that fluid in, and then once that fluid is in there and it's been there for 15-20 minutes, we will then perform the liposuction. And again, it can't be guaranteed that you'll have perfect symmetry, but I always tell patients there are areas of diet-resistant fat. I remember one time I did a young lady from Pine Island. She was 4'11", weighed 85, 90 pounds, but she had little saddlebags. It was genetically predetermined. So I did a little liposuction. I removed about 50 grams from the left, 50 grams from the right, and all was good. So there are areas of diet-resistant fat, so no matter how much you exercise, it's not going to go away. Now, what can you expect post-operatively? Post-operatively, I generally, again, will tell patients the first 4 days to lay low. When I had my liposuction, it was more like needles and pins, prickly sensation. We give patients pain pills. We put them in a compressive girdle. Many women will come in, they'll buy a girdle, or they'll buy some of these spandex Spanx type garments, and they're very effective in limiting the amount of swelling, and also they provide a certain degree of comfort. So I tell patients you should wear compression pretty much 24/7. The only time that you take it off is when you take a shower, and I usually will take patients take a shower in a day or two. The incisions are tiny incisions, maybe half a centimeter to a centimeter. We close them with one suture. We take them out in 4 or 5 days. Now, the compression is important probably as much as for the first 2 weeks. The more loose skin you have, the more important compression is for 3 weeks, 4 weeks, 5 weeks post-op. So that's a determination we make after the procedure. Risks with liposuction: bruising, swelling, infection, bleeding, asymmetry. You can have surface irregularities. But by and large, it's a great procedure, and usually it will take, by the end of 6 weeks, you will be about 80% or so of where you're going to be. That last 10, 15, 20% will come about over 3 months, 4 months, 5 months. But again, it's a wonderful procedure. It's a great procedure to get rid of those unwanted deposits of fat that just won't go away with diet and exercise. And believe me, there are a lot of people out there that have them. The next thing I want to talk about is what we call a tummy tuck, or an abdominoplasty. Now, many times patients will send me an email, "What do you charge for a tummy tuck?" It's sort of like going into a car dealership and say, "What do you charge for a car?" A lot depends on what your needs are. For example, sometimes somebody will come in and need a mini tummy tuck, which means they have a limited incision and very little loose skin, maybe a little tightening of the muscles. Sometimes people come in and they need a paniculectomy, where we're taking a huge amount of skin and fat. So they're all variations of a theme. But generally speaking, an abdominoplasty is a procedure done once again as an outpatient, and it involves incision across the lower abdomen. We will usually cut around the belly button, leave the belly button attached to the abdominal wall. We then will undermine or separate the skin and fat from the underlying muscles and pull it down. It's sort of like a window shade. You know, we pull it down, the excess is removed. In some cases, we tighten the muscles, and then we stitch it and a drain is placed. Now, we sometimes will stitch the muscles, and we call that diastasis. That is, the muscles in the abdomen separate. Very commonly after pregnancies, the muscles will separate. So we go ahead and tighten those muscles, remove the excess skin, put a drain in, put the patient in a binder. They go to recovery room. The length of the procedure can take anywhere from an hour and a half to 2.5, 3 hours, again depending upon the degree of complexity and what we have to do. And I would say today I would probably utilize liposuction 60–70% of the time in my tummy tuck. The most common procedure that I do regarding abdominoplasties is to suction the flanks, the back side, because I want to contour the abdomen so it's concave and looks nice. So we'll put somebody on their stomach, I'll suction their love handle flank areas, place some supine, and then complete the procedure by doing the formal tummy tuck. Sometimes we will also liposuction above the belly button if it's necessary. After procedure, the patient goes to the recovery room. They're in the recovery room for maybe 2 hours and they go home. And for the most part, they go home and they rest. I usually tell them put a pillow underneath your bed or underneath their knees and just sleep and just take it easy. The most important thing, in my opinion, after a tummy tuck is early ambulation. You have to get up and ambulate. All my patients, whether it's a tummy tuck, liposuction, whatever, put support stockings on and they ambulate. The one thing you don't want to do is sit in a chair for prolonged periods of time. You want to ambulate, and when you're not, you're lying down with your feet up, exercising your calves to promote good circulation to your lower extremities to prevent the pooling of the blood. So you're walking or lying down with your feet up. And usually most patients are up walking the next day, and by 24 hours you're standing straight up. I generally will have patients shower after a day or two. So they take their drain, they pin it to their panties, take a 5-minute shower, blow dry, put a towel over their abdomen, put their binder on, walk or lie down with their feet up. That's really important. And again, for the first 4 or 5 days, lay low. After about 4 or 5 weeks, generally I err on the side of maybe closer to 5 weeks with a tummy tuck, particularly if we've tightened the muscles with sutures. And then after 5 weeks, you can pretty much resume normal activity. What are the risks? Bruising, swelling, again, infection, bleeding, asymmetry. There can be blood clots. That's why we get patients walking very, very early. One of the big advances now, we use a product called Exparel, which is a long-acting anesthetic agent. So after we complete the plication or suturing of the muscles, we inject that local anesthetic into the muscle area, which almost eliminates the pain. So between the Exparel plus the post-op pain medicine we give you, most patients have no problem ambulating up and about and going around the next day. So it's very, very popular operation. And again, I think it's important to understand, usually about 70–80% of the time I combine it with liposuction because I really think it enhances the overall effect. Now, the last procedure that I want to talk about is fat grafting. I think you're going to see more and more people talking about fat grafting. I recently got back from Montreal, and that was one of the hot ticket items, fat grafting. Now, what is fat grafting? Fat grafting is an autologous graft. Now, what do we mean by autologous? An autologous graft is a graft that we take from your body and put it into another part or area of your body. For example, we would harvest fat from your tummy or your flanks and augment it in your face or into another area that was deficient. Now, one of the things, for example, when I do facelifts, probably 40–50% of the time, and I think that number will increase now, I will add fat to my facelift procedures. Because as we age, for example, in our face, we go ahead and we have superficial effects of aging. We have brown spots, we have fine lines, we have sun damage, we have red crusty areas. So we have superficial blemishes. Secondly, our skin thins. As it thins, we have loss of elasticity and we get the jowling, the excess skin. And that's true of any part of our body. Part of our thighs, part of our stomach, part of our breast. They all have the same effects. The third aspect of aging is what we call atrophy of the soft tissue. So if you looked at the picture of somebody at 20, 40, 60, and 80, you will find that as they've aged, they've lost volume in their face. Look at a woman's breasts from 20, 40, 60, 80. They will have lost volume. That's part of the normal aging process. So more and more now we go ahead and we will take fat from one part of the body and we will utilize it to augment another part. Now, what areas of the body can we augment? The two most common areas are the face, and again, 50% of the time I do fat grafting to the face, and it'll probably be 70, 80, 90% of the time now. And another area is the breast, to enhance breast augmentation. These are two areas where I think you're going to go ahead and take and put fat to enhance the aesthetic outcome of the procedure. Now, how do we do this? What we do is we do suctioning, but we use small cannulas, and we use a syringe with very low pressure to harvest the fat. And we harvest whatever we think we're going to need. For example, in the face, we might put 10 cc's of fat. We might put it around the eyes. We might put it in the temple areas. We might put it in the lips. We might put it in the marionette areas of the face. We might put it in the submalar hollows. So we can put fat pretty much anywhere on the face. I've put as much as 70 cc's in people's faces, depending upon the need. The other area would be in the breast. Now, sometimes you can put 200-300 cc's per side in the breast. So you have a lot more leeway because you've got a much bigger area to cover. The harvesting technique is with small syringes, and then you remove the fat. Now, there's a little controversy how you prepare the fat for transplanting it back into another part of the body. Now, what I generally do is I will take the fat and I will wash it with lactated ringers to get away the serum and clean it off, and then dry it on some sponges, and then we will carefully transplant or put the fat into sterile syringes. Usually these are 1 cc syringes, or in some cases, if we're doing large volumes like on the chest, I'll put it in a 10 cc or 20 cc syringe, and then we go ahead and transplant the fat. Now, what's important to understand, when you transplant fat, you don't just put the needle, the cannula in there and just blow it up like a balloon. You layer it in different layers. And the idea is you want to maximize the exposure of the fat to the patient's body to enhance the viability of that fat. Now, in most cases, not all the fat's going to take, but I always tell patients whatever fat does take is yours. It's not going to go ahead and dissipate like a soft tissue filler like Juvederm or Restylane or some of the other hyaluronic acid fillers. So you're going to hear more and more about fat, and I prefer it more than anything else for soft tissue augmentation because it's your tissue. It's natural. It's not going to go away. I always comment to some of my patients when they come in for evaluation, can you put some fat in me? And they're 5'3" and they weigh 95 pounds. I say what you need to do is go home and have some more banana cream pies. So it's always good to have a little extra storage area of fat. Now, one of the other things that I will sometimes do to enhance the taking of the fat is I will pair it up with what we call platelet-rich plasma. That's derived from drawing off some of the patient's blood. We spin it down, we take the platelet-rich plasma, it's all done sterilely, and in that platelet-rich plasma, the platelets have things called alpha granulocytes. Now, in those alpha granulocytes are epidermal growth factors, angiogenesis factors, all the essential peptides, protein, call them whatever you will, that are essential to regenerate your tissues. So we take those PRPs, those platelet-rich plasma, and we combine it with the fat to enhance the viability of the fat. Now, there was a study done recently which did not show a difference in the viability of the fat. I tend to think it can only add or enhance the viability of fat. And then if there's some left over, then what I will do is do a PRP facial, for example, on the face, where I'll take small dermal rollers and we will make little punctate openings, and we'll take that PRP and put it in there. Let it soak in, put a collagen mask on, and let it sit for 20 or 30 minutes, then send the patient to the recovery room. So fat grafting is an outstanding procedure, and in the meeting in New Orleans, I think you're going to see more and more people doing it. I'm excited about the possibility. I'm excited about what it can offer patients, both in terms of facial rejuvenation, breast reconstruction, and other areas of your body. So I hope this has answered a lot of your questions concerning some of the more common cosmetic surgery procedures. Again, if you want to contact me, go to my website, Beauty by Brueck. There's a link there to request a consultation. You can call me at 239-244-2329. Again, thank you for taking the time to listen. I look forward to talking to you personally.